Are you having some pain on the outside part of your elbow? If you're having some tennis elbow issues, which is the overuse of your wrist extensors, which is common in tennis players, but also many other sports and activities, then this video will definitely be helpful for you. So for people that are experiencing tennis elbow symptoms, often they will have pain on the outside part of their elbow with gripping activities, maybe racket sports, and anything where your hand is in this position where you need to use your wrist extensors. When you're having a lot of pain, that can be hard to manage, and that's where physiotherapy can be helpful for you. Often, because this is an overloading issue, we need to underload it in some way to help calm things down, or at least load appropriately. That might involve changing your activities, or maybe using a brace to help offload those tendons that are getting irritated. Other things that we want to be doing is doing some exercises to help strengthen those tendons. Exercises like grip strength, wrist extension, dumbbell exercises to strengthen those tendons and the muscles in through your back of your forearm can be very helpful to get those tendons to calm down and build up stronger. You can even do things like stretches where you're stretching those tendons out gently. All of these exercises need to be done at the right time and at the right difficulty level. If you have any questions about where to start, checking in with a physiotherapist to get your starting place can be the easiest place to go to know that you're doing the right things. What else can we do here in the clinic to help you out if you're having difficulty with the tennis elbow pain? If you're having trouble calming the tennis elbow pain down, often there's many other types of treatments that we can do other than exercise and load management to help calm things down. There's treatments like acupuncture, which involves very small needles going into usually 3 different spots in through the outside part of the elbow to try to stimulate the area, draw some blood flow to the area, and often there can be an endorphin response which could be contributing to some potential pain relief there. It's a great option for people to try if everything else isn't quite getting it better fast enough for you. Acupuncture isn't necessarily going to fix the problem, but sometimes it can just calm the pain down a little bit and allow you to continue with those other treatment strategies a little bit easier.